think as a facial plastic surgeon, really a complete facial plastic surgeon has the ability to do hair. Having that full head of hair, having that new confidence, I can really change somebody's life. And I think it's a frequent problem that our patients face, and patients love having that ability to come to be evaluated both medically and surgically by me. And a lot of times there's crossover. I've had treated patients with facial trauma. They were missing an eyelash, an eyebrow, or people who've had a facelift and another practice and had scars, or they're missing the temporal tuft of hair, or their hairline was malpositioned. Now I have an ability to treat that, so I think it makes me a more complete facial plastic surgeon, being able to offer that service, but also to treat people who have trauma or injury or other problems related to hair. So. I think people, it sounds trite because everybody's using this, but the social media, I think a lot of focus and intention on beautiful heads of hair, and as they've always done in commercials since the 70s, Pantene commercials with people waving these, luxurious heads of hair, and it's just seen as a sign of youth and vitality to have, nice hair. So I think that kind of hyper focus for people, and I think especially becoming more important for women, and that's just a byproduct of the times we live in. I think everybody's really more image conscious because there's lots of images around now of us that there weren't before, lots of photos and videos and things like that. So it's kind of brought it more to the forefront. I think the difference and the way to approach it is really what makes the hair loss practice unique here and in other physicians' offices, is we have that medical background. We really can kind of wade through all the noise that's out there on the internet and with regard to what's going to be effective for an individual patient. First thing is a comprehensive medical history. I mean, there's lots of medical causes for hair loss, from thyroid condition to anemia to vitamin deficiencies, and people need to be evaluated properly to determine, is there some kind of medical cause that's causing the hair loss, and then therefore can be treated very simply with that. Or if there is no explanation and it's solely androgenetic alopecia, most common cause of hair loss, what are the options and what's going to be most effective, and we can really give them the kind of evidence-based knowledge that's uses proven therapies instead of people, unfortunately, searching to some of the latest fad. I think it's supremely important for us to get patients on medical therapy, and that might involve treatment with minoxidil. It might involve treatment with finasteride or dutasteride. Medical therapy kind of enhances surgical results, and sometimes we also will, even while doing a transplant, combine that with PRP, which is platelets, which are compose the right mix of growth factors to help encourage hair growth. And PRP has been shown to aid people in healing post hair transplant. It's been shown to increase the take or growth of grafts. So we combine all those different therapies along with surgical therapy to get kind of the optimal results. Sure. We did a case series of 5 patients who were treated with a compounded topical formula in which we actually doubled the strength of the minoxidil found in the over-the-counter Rogaine. So we increased it to 10%. We also added a topical finasteride, 0.05% in that formulation, and wanted to see if it was safe and effective for patients over 6 months of use. And we found that it was extremely safe, very low risk of side effects, and actually improved hair growth in almost all patients who were included in the study. And this was validated with photographs by an independent observer. So very excited about showing the efficacy and safety of this topical formulation for hair loss. It's really to seek out a medical professional who's qualified to do an evaluation, to do the proper blood testing, to tell you what the possible therapies are, and don't rely upon the latest fad on the internet, or waste your time and money and energy in looking for the miracle cure for hair loss, because you really need that kind of comprehensive approach.